Great, thank you. So welcome to this meeting of Children and Young People Scrutiny Committee. Agenda papers and other relevant information for the meeting are available for public viewing on the Herefordshire Council website. Council's making a recording of the meeting, which will be uploaded to the Council YouTube website at the earliest available opportunity. Other attendees are permitted to film, photograph, record our public meeting, providing it does not disrupt the business of the meeting. If you don't wish to be filmed or photographed, please identify yourself so that we can be made aware. Thank you. So to ensure that recording quality is maintained, please can members speak as clearly as possible, keep background noise to a minimum, ensure mobile phones and the devices are turned to silent, including computers. Joining us remotely today, we've got Councillor Claire Davis. Good morning, Councillor Davis. Can you hear us?
I can see and hear you. Thank you.
Great, welcome. Thank you. Any members of the committee or co-optees with voting rights can join the meeting remotely, but they're not able to vote on resolutions of the committee. Thank you. Right, we've got a number of officers present today, and we'll ask you to introduce yourselves as you come to the specific items if needed, please. Have we received any apologies for absence?
Yes, we've received apologies for absence from Councillor Frank Cornthwaite, Councillor Robert Highfield and Councillor Ivan Powell, who's the Cabinet Member for Children and Young People. Okay, thank you very much. And I'd just like to welcome Sarah Beard. You're the new co-opted member for the diocese. Thank you for coming. Welcome to the committee. You're coming in at a good opportunity to hear about some of the great things that are happening in terms of children's services. So welcome. Right, do we have any named substitutes? No named substitutes. Okay, thank you. Are there any declarations of interest by members respective items on the agenda? No? Okay. The minutes, so to approve and sign the minutes of the meeting held on Tuesday the 12th of May. I haven't been notified about any corrections of accuracy. Has anybody got anything to raise on that? No, so can we just vote that those minutes are agreed, please? Thank you. Right, have we had any questions from members of the public? No questions received. Thank you. Any questions from members of the council? No, we've received no questions. All right, well that takes us very neatly on to item 7, which is the Families First programme. So I'll hand over to you, Tina Russell, as the Director of Children's Services. Thank you.
Thank you. Good morning, everybody. So I'm not going to say much, actually. I'm going to hand over to Dawn Knight, who is our Families First lead, and has been since we started the implementation of the Families First programme, which comes from the Children's Social Care review that was undertaken some years ago, and is also formed now as part of the Children's Wellbeing and Schools Act. So the Families First programme is part of that wider changes within children's services, and we are at quarter 1 in year 2 of a 3-year implementation programme. So we're here to give an update on where we're at in year 2. So I'll hand over to Dawn.
Good morning, everybody. And as Tina says, I'm Dawn Knight. I am the Families First Service Manager and the lead on Families First for Herefordshire. So I provided a very brief report just to give an overview of where we are now in year 2. So just to reflect in the report, year 1 as part of the Families First programme was around just sort of transformation. And part of that transformation was really coming together with partner agencies, children and families, building our steering group, which we have got a very large and committed steering group that have got members from our police involved. So we've got a detective sergeant who's involved in that steering group. We've got representation from schools on the steering group. We've also got ICB and health colleagues. So for me, the rationale for having that multi-agency approach in that steering group is because the reforms aren't just about what's in children's services, it's about the reforms out in the community, out in those universal services, who are already offering a really good level of early help already. And it was looking with those partner agencies how that can be strengthened and where it's appropriate for them to be involved in being the family help lead practitioners. So there's been a whole year of collaborative and co-production work to get us to this point in year 2. So I have listed down there just some key points from the transformation to date, and we know we've got many other colleagues who need to attend the training. We've had 170 colleagues that have attended the Families First training, and for us what we recognised was some of our partner agencies were very skilled at working with children and families, and they knew the families well, but there was a worry about perhaps having those challenging conversations, and perhaps maybe discussing situations where risk might be perceived. But really what we did in our session 1 training was unpick challenging conversations, unpick how those conversations could go restoratively with families. And we just got a bit of feedback here that on the whole, the most of our providers and partners felt that it was great to understand the context of how family help can be applied in the community, and they really found that engaging with discussions from other professionals in the breakout room helped their learning and understanding of how they can extend their offer of early help. So if we move on to year 2, because that all of that work last year was underpinning. So in terms of outcomes, the outcomes are that we've built relationships, that we've been able to implement a one assessment or family help assessment that's been worked on collaboratively. So in year 2, which is our implementation, as Tina said, has just started in April. We've been through a management of change process. We've consulted with all staff about the changes that were needed for us to be able to implement the delivery and the expectations from the DFE over the next year and 2. So the first part of the management of change, we've established a Families First team, and the purpose of that team is to support those partner agencies to be able to deliver on family help, and for us that includes consultation. It includes having a named community development officer for your area. We deliver training. We have a package of support for those practitioners who are taking on family help, and that includes help to set up the first team around the family meeting, help with the minutes of those meetings. And what we've found over the last 2 months is we've moved from that sort of apprehension, I suppose is the word, of we don't know if we can take on that role, to actually we've got practitioners who are taking on that role. They're very connected with their community development officers, and they are leading on those family help plans. So that for us is a real tell that the support that we're offering is good, it's right. And obviously over time we all need to tweak that. And what we've said to our partner agencies is it's not just about this is the offer. We'll keep coming back to define that offer, redefine it, and see what else it is you need. So that we definitely build those trusting relationships there. One of the key elements of the Families First programme is to bring together targeted early help and children's social care, children in need and child protection teams into multidisciplinary family help teams. So the management of change has absolutely delivered on that. We now have 3 family help teams in the north, south and central localities. That includes qualified social workers, that has alternatively qualified family support workers and other practitioners, and multidisciplinary practitioners. And what that will mean is that the right person can be identified from within those teams to lead on family help when needed. And the third pillar of Families First is the multi-agency child protection team. So this, for us, is a work in progress. But I should have said about the family help teams. We went live with those on the 1st of July. So those teams are in place. They're having training, team building, and then they're delivering on the programme. Multi-agency child protection teams established. We're going to have 2 that across the county. And we've got 2 identified team managers and 9 lead child protection practitioners whose role there will be to be involved in the Section 47s and the strategies, and making sure that there's expert oversight of that across the service. We've got a strengthened, I've called it family group conferencing service, but we've actually now calling it family-led decision-making service. That has gone from strength to strength. That's been there for the whole of the programme, and we have expanded that team, added more practitioners in there, and we've got a new service manager, a new team manager who's leading on the implementation there. What we know is all of those changes have put us in a very strong position to be able to deliver on the Families First reforms over the next 2 years. So one of the key factors for us around MAP-PT is that the protocol and operating principles have been jointly put together and designed with police, health and education leads. And as I said, that MAP-PT process will be live from August 2026. One of the key factors that we needed to implement was a family help assessment, and I think I've talked about that before in Scrutiny. That was making sure there was only one assessment for families to have, rather than having stop and start points and different assessments and having to tell their story more than once. So with a lot of collaboration, discussion, testing, piloting and feedback, we're really pleased that we now have that one assessment that is used across the whole system of support. So our partner agencies can use that if they're out in the community holding a family help plan, and we can use that all the way through our system in children's services. Feedback from the practitioners who've been piloting it said that they really liked the flow of the form, that it was simplified and it sort of made sense and flowed really well. Families really like the form, they really like it, and they like that their own words are being used to tell their story. And what we've made sure we've done is put the family's story front and centre. So it's the first thing really, apart from when you've got the details, it's the first thing that you see when you start the family help assessment is the family's story, their voice, their experience, and what they think has brought them to be in this situation and what they think will really help them to move forward. So for us, it's really satisfying that families like it, because that's what it's about, isn't it? One of our big tasks is, once we've made a family help assessment, is then we've got to build it on Mosaic. So Mosaic is our case management system, and we've been working incredibly hard with our systems team, and that is on Mosaic, able to use, and as I say, will be live to use from the 1st of August. And another exciting development for us is that we've talked with children and families, and we're in the process of designing a digital self-assessment. So at the moment we've got the family help assessment, but what we want families to be able to do is to self-help where they can. So we're in liaisons with a company that we're going to design that, so that actually families can first and foremost go onto a platform that if they just need a bit of advice and signposting, they can access that. But however, if they wanted to go on and then start to design and write their own words for the family help assessment, they will be able to do that as well. So we've checked this out with some of our families making a difference. They've had a little look at the platform and the design, and their feedback is it's a great way for families to help themselves, and they very much feel that having that digital self-assessment will help them to access support at an earlier point. And then with all of this, obviously we have to make sure that what we're offering is of good quality. So we have designed our Families First Assurance framework. It's complete, and for each of the areas of the reforms, we've got KPIs Yeah, that would just mean that going on in the next couple of years, we're able to quality assure what we're offering, and where needed, we will be able to tweak things. So it is a very brief overview of what we've been up to and where we are in year 2. We have, of course, got an ongoing training programme for staff and partner agencies, so that everybody is really aware of the changes, their role in there to support children and families, and who to go to if they need support to do that. So that's a very brief overview. Do we invite questions? Tina, do you want to add anything?
Yep, thanks, Dawn. It is a succinct overview, I would say, of a lot of work, which I think you've described really well. I would just draw out a couple of points. One was that Dawn's talked about the community development officers in children's, who are there to support those partner practitioners to be the family help lead practitioner, and that is both practical support in terms of arranging meetings, minuting meetings for that first meeting, coming together with parents and families, but also delivering on training and those sorts of things about how to use the assessments. But in addition, as part of this programme, we've also retained and developed, probably the right words, a specific team of staff that sit within children's services under Dawn, who will also undertake some direct pieces of work with children or families. They're more task-centred pieces of work, but sometimes when we've got those universal or community practitioners leading the plan, there may be a particular piece of work that the support workers in Dawn's team are particularly skilled at, or perhaps a complex case that they would feel the benefit of having somebody else leading a piece of direct work. So we have the facility to help those family help lead practitioners with doing a little bit of direct work as well with a family where we need to. Dawn's talked about the what's in place and what's going to be ready. We've obviously got a transition period. Children's Services hasn't been able to stop and close its doors while we implement Families First and do the management of change and move staff and all of those things. We're still working with all of the children and all of the cases and all of the families, whether they be children in need or children subject to child protection plans. So we are having a transition period, and we are instrumentally implementing parts of the process as soon as we're ready to go. And that transition process, its absolute priority is to make sure that children don't have to have a change of worker unless absolutely necessary. And where they do have to have a change of worker, we are waiting for a suitable handover time and process. So it might be at the review conference, or it might be at a team around the family meeting, or we're some staff are holding cases till they complete a piece of work where their case is expected to close. So we're trying to make sure we've got minimal change for children and families in that change of worker, and at the same time building the skills and the confidence of our staff who are either taking on the lead child protection practitioner role or are taking on the family help lead practitioner, and that means doing an assessment which they haven't perhaps done before. So it's a real, implementation programme between now and August that's already underway. And I will say that the staff across the services have been excellent with working with that with us for those reasons. And then, as Dawn did say, and I just wanted to emphasise that bit about the self-assessment, we're really, really pleased about. We haven't seen other children's services developing that self-assessment. And one of the things that we know has been a real challenge for us is when families have to describe their account of their lived experience, their lives. And when we've been doing assessments with families, we obviously talk to them and we get that information, and then we record it within our social work and family help assessments, and we record that as much as possible in the words and the phrases that have been used by the families. But it's never exactly what you said, because I need to summarise that in my assessment, whereas this self-assessment gives the family the opportunity to do exactly that. They can write as much as they want in their words about what they need, what they think their strengths are, and that one level enables them to write that in and follow links when it's finished, in terms of if I write in that I'm worried about my alcohol consumption, it's really increasing and I'm feeling very low. If you write that in, you'll be able to access a link that will take you to a support service that might give you that support that you need. If you want to, and you do then continue to a family help assessment that's undertaken by a practitioner, those words will move into that family help assessment. So I think that's really important, that we are retaining those families' own words in that wider assessment, because when you then read that as a practitioner and you're reading what that person says, you don't have to be the one practitioner that had the opportunity to talk directly to the parent. You can be the practitioner down the line that reads exactly what they've said and how they've said it. And I think that's something I'm really looking forward to, is seeing that in practice. So as Dawn says, I think we've worked really hard. Dawn's been brilliant. We've had superb engagement from our partners and from our families that have engaged with us in the co-production of some of these things. And we're in a very, very strong place to implement pretty much everything by August. And actually the implementation date for some of these things is March next year. So we'll be well in advance of that as well.
Thank you. It's really welcome news. Obviously, we've talked a lot for a long time about the support for families and early help, and it's great to see the government bringing in these changes, and the fact that Herefordshire is was in the right position to grasp those and run with them. So well done on that. I think probably there will be questions around sustainability of this scheme, and in terms of the financing, and we can set it up, and then how do we know that it's embedded? So I think that's one of the key questions. But I think the very key question for me is how will we know that this is making a difference to the lives of children and their families?
So I think, as Dawn described, we have developed a quality assurance framework that is specific to the Families First implementation programme. So you will know that we've already, for the last 2.5 years, had a very clear quality assurance programme, which consists of KPIs, which includes service user feedback for families that have been through an assessment, which asks them how they've experienced the undertaking of that assessment and what difference that intervention has made in their lives. And we have our audit activity, which scrutinises target audit activity, looking at the quality of practice and the compliance with process and procedures. So for our Families First programme, it was important to us that we retain that, because we know what we've been doing. We've got some solid outcomes from the quality assurance programme for 2 years now, but we're adding on to that specific KPIs, specific service user feedback, specific practitioner feedback, and specific targeted audit activity, where we will deep dive on what were the changes, what have we done differently. So for example, the multi-agency child protection teams are developed to specifically lift out and manage anything within the child protection process. And that then works alongside and parallel to this family help process. So we want to know how that works for practitioners, how that works because you will now have 2 workers working together, one leading the child protection, one leading the family help. How does that work for you as 2 practitioners? And we will ask them, how does that work for families? So whereas previously they had a social worker, that if a child protection issue came up within that case, then that social worker would do that investigation. How does it work for them having somebody else coming in and doing that child protection? And we will ask those questions and then do the audit activity. And we will be able to compare that data and those service feedbacks and the audits with what we were gaining. So some of them are very similar, and we will be able to compare. So for example, in our current activity, we say to families, how do you experience the multi-agency working when there are multi-agency groups of people involved in your family? And we ask them that question. And generally about 80% of the top of my head, should have prepared that data, shouldn't I, say, yeah, it works well. We think the right people are involved. We think the information sharing is good. But we also take the feedback of where people say, no, the right agencies weren't involved. We ask them, well, who do you think should have been? Why not? And we will be able to compare the results that we've been having for the last 2 years with the results that we get from Q2. We will start asking those questions, and we'll be able to, by the end of the year, have those comparisons. So it gives us the comparison, but it also means that on a quarterly basis, we'll be able to pick up very quickly things that where we're getting feedback that this isn't working, either for practitioners or for families, and we can look at what we can tweak or amend in the system that we've designed. And year 3 will be about that embedding that implementation. So hopefully that kind of answers that. In terms of the embedding of the implementation, so we are getting grant funding for the Families First implementation and embedding in the programme. At the moment, that is a 3-year grant funding, last year, this year and next year. What we've always been mindful of, the grant may then stop. It's not dissimilar to what was Strengthening Families, Stronger Families, which has been in place for many, many years now, and is developed over time by the government, but it always has been seen and recognised as an important part of the Children's Services grant. If anything, what's happened is that they have, the government have amalgamated the grants into Children's Services into more one and made it clear what is protected for Children's Services. What we're expecting is that there will be a level of recognition. The level of detailed finance and data reporting that we are sending back in is significant. We think the significance of that is that that will inform what level of continued grant needs to continue beyond. So I think we've got the balance right between implementing the new system. There is absolutely no fear that if the grant were to go next year, our Families First processes would not fall apart. They would continue. We've got enough in base budget. We've got enough where we are acknowledging, that would need to continue. And obviously, if the grant doesn't continue, then as part of our budget setting processes, where there are things that would be at risk, we would be putting that in for growth within Children's Services, and we would be able to be bringing the evidence base from the way that I've just showed you about why we need growth. For example, in Dawn's service for those 7 workers, just as an example. I'm not saying they're a risk, any of those teams listening, but as an example, if the grant didn't continue and that was at risk, we would put in a growth bid and say, this is the evidence of what this team have done and how they have worked in impact, and therefore we're looking for growth. So I think we've got a nice balance. It won't fall apart if we don't get the grant. We will have the evidence base to bid for growth in the children's budget to cover things that wouldn't be covered if we don't get the grant, but we've also got enough where we've moved and blended roles within base budget, that our Families First fundamental programme will continue.
Thank you. And I think obviously going forward, councillors will be asking, are we getting value for money? Is there value for money in this programme? And I think,
Yeah, sure. So a couple of the things that we're looking at is within our quality assurance programme is things like repeat assessments, repeat child protection plans. We've always looked at repeat child protection plans, but they are going to be key. Repeat social work assessments, repeat referrals into the system. That will show us whether families are getting the sort of help and assistance they need to stop them being re-referred, and obviously ultimately the numbers of referrals and the numbers of children who are subject to a social work assessment in the first instance is the other kind of measure of, if that goes down, that's a good thing, because that's showing us that actually the numbers of families that are being helped in the system, which we're also recording, will be helping those families. But we do need to triangulate that with repeat assessments, repeat child protection plans, and that's where we will see where the added value is in the experience and the outcomes for families.
Councillor Proctor.
Data into the question.
This isn't actually a data related. I have some data related stuff,
But this is sort of following that on. So obviously we have been with you on an improvement journey. Later on the agenda, we have done a deep dive into early help, and we're basically saying, yeah, this is really good. So there's a risk that all of this change in the system, which is mandated by the government for kind of national systemic problems, could actually lead to worse outcomes. I'm not saying that's going to happen. I'm just saying that's potentially a risk because we actually deliver good services. So how are we mitigating that risk and making sure that these changes are part of improvement?
So, as I kind of referred to, the Families First programme comes out of the 2023, 24, I want to say, who now Minister Josh McAllister led the review of children's social care practices back then, and the Families First programme was a recommendation from that review. He then subsequently became the minister implementing his very own recommendations, as it were. So we've known about these changes way back. So our improvement journey completely 100% factored in what those changes and those recommendations were about. And it wasn't difficult to factor them in because the changes are not anything other than what the workforce in children's social care want to do. Generally, social workers, 99.99% of social workers don't come into children's services so that they can remove children from families. They come into children's services so that they can improve the lives of children. So firstly, we knew what the recommendations were. We knew the direction of travel. So it's all been incorporated into our improvement journey. And secondly, we've not been pushing against a closed door because that's what the workforce want to do. The restorative practice, the strength-based practice is all about supporting families as early as possible. And we've recognised, I mean, I've been doing this job a long time, as have my range of colleagues here. And we knew, we did the survey, but we knew that the risk for our partner practitioners on being family help lead practitioners was either going to be about management of risk or capacity. You know, our schools are under incredible, immense pressure. You know, they have got the Families First reforms, but they've also got the SEND reforms. And so knowing what those pressures were, you know, we did the survey to ask them as well, just to reinforce what we thought we knew, and we were right. And that's why we've developed these both practical and theoretical kind of supports to those people around the advice, the guidance, the practical support to arrange meetings, the workers in Dawn's team to do some complex direct work if we need to. That's why we've put these things in place, because we knew what those concerns were. So we've kind of tried to mitigate as much as we can any challenges in terms of putting that in place. So it was incorporated really into our improvement journey. It's not an add-on.
Can I just come in? I'll just come in there as well. We have had the benefit in this journey of 10 pathfinders, different local authorities that have already gone before us, tried and tested a lot of things out. They're in positions now where some of the things they put in place, they're just tweaking and changing. But one of the things undoubtedly they've all said when we've gone to regional forums, national forums, is this process has really helped to strengthen their early help offer, then actually bring the partnerships together even more closely. So if things do arise, they can unpick them together. So I feel fairly confident from that feedback from our pathfinders that we'll be in the same position in Herefordshire, that this can only strengthen our previous early help offer.
Okay, Councillor Davies, you've got a question?
Yes, please. Thank you, Chair. Thanks for the presentation. Really happy with the way things are going. I see that we're now into year 2 of this programme, and consequently the platform for self-help has been developed. Is that something that was came to light from the first year of talking to families and trying to bring that in? And as a part of this, the self-analysis, are we going to be able to track that for the future? So somebody might dip into it and go, well, I'll use that self-help tool, and then decide that they can't express themselves correctly. So consequently, have they got the option then of opting out of the self-help tool and speaking to an assessor?
Yes, that's definitely part of the design. So they can do that self-help to start with, but they will definitely be able to make contact with somebody if they want to then progress to the family help assessment. They won't be left to do that on their own.
And not all families will want to, and they're not required to do it via a self-help assessment. The self-help assessment, I actually saw an example of it in adult services, and it was that interactive way, and I really liked it. And I contacted the design company to say, have you ever done this in children's? And they hadn't.
No.
So we're their first local authority, and so it is what it says, really. It is that ability for families to be able to log in. We won't track them all. The idea is it is open there for families to log in. We do need to get that balance right in councils, not just Herefordshire, but all councils, between we want families to be able to help themselves, we want them to access universal and support, and yet as a council we want to control and know everything that you say and everything that you do, and that's not right. So actually we're not going to track everybody that uses it. Clearly we will have a usage data which tells us how many people have started it, and we will have usage data on how many people have ended it. But that in itself doesn't really tell you a lot. What we will have, of course, is that for each of those families that do that self-help and then go into links to say, for example, I want help with my substance use, each of those will be some form of service that is provided, either contracted or grant funded or whatever. So each of those as individual services will have mechanisms for being able to record. We may find at the second half of the year that self-referrals to substance misuse go sky high because families have written in and thought, oh, I'll go to that link and I can refer myself. So we will be absolutely looking at those links and those services that have got and talking with them about, have you seen a difference? Have you seen a change? Have you seen an increase? There's a number of ways we can monitor the impact of how helpful it is. And then, of course, when if we do get referrals that do require that family help single assessment, we will ask the family, did you do the self-help assessment first? And we will just be able to know whether they did or not. There's no right or wrong about that, though. It will just tell us whether families have tried to do that or not. And so if they have tried that and we find that, we will ask them, did you find that helpful? It will just give us a kind of another level of feedback where they might say, yes, I found it helpful and I thought I was fine, but my school have still referred me, or I did it, but I didn't find it helpful, and that's why I've referred myself for a greater assessment. So there are a number of ways that we can kind of pick up how that is being experienced by families.
I think it would be really good to have that level of data where we understand how the take-up of the platform, compared to other front door methods of coming in to get assistance, and that kind of information would be really good for the future.
Yeah, very good.
Thank you.
Councillor Proctor's got a question.
Just following this on, so this sounds like everything you're saying sounds kind of really interesting, but I can't get a sense. I don't know if we have a sense of, is this likely to be a really big thing that lots of families will use and will be a significant front door in, or whether it'll work for kind of a subset, and there's a lot of things that will need to be around it to make it work. So obviously families will need to know that it exists. We'll need to maintain the kind of data about what services are available. So do we know how much it will cost, not to build the thing, but to kind of maintain it and make it work?
Yes. It's actually not that costly to build and maintain, but once we've built it, it's a web form that people can just fill in, so it won't be costly to kind of maintain it. Whether it takes off or not, we don't know. It might not. Families may find it very, very useful and want to use it and find it interactive and get the information. They may not. Families that, like you say, the families that are We may find that families that are in difficulties don't use it because they want to revert to their school or their health visitor or their community group or their, somebody that could act as a family help lead practitioner, and they want them to help them do that assessment, which is also fine. But we might find there's a group of families, that parents that think, yeah, this is valuable, this is my way of finding out more information. So we don't know, but we wanted to make it available to test it.
And if I come in there, I think we've got a great opportunity here because, as I've said, we've got a multi-agency steering group. We're training all of our partner agencies in the family help process. But as part of that, we've started to discuss with them in terms of this will be a digital offer that's coming. So that currently, and I'll just use schools as an example, many of our schools produce their early help offer and put it on their websites. So for me, I would see a link from those early help websites on there that can take the family straight there. So first and foremost, we will promote across our partnership through our steering group, through our training sessions, and make sure that everybody who has contact with children and families is aware of that and can offer that as a first opportunity for families to seek support. So I think we've got a really good opportunity and people are very excited about it. But yes, you're absolutely right, we need to advertise it and make sure it's well used.
And to what extent have families been involved in, because obviously if you go and buy something that's off the shelf, you're kind of buying a thing that's already designed, but so to what extent have families been able to shape it, and what opportunity is there for it to be evolved?
It's not really been an off the shelf because I say they've never done it in children's before. The only bit that's off the shelf is the technology within it. All of the questions, all of the links are Herefordshire. So Dawn and the team, myself, we've all been inputting to how do we phrase the questions, what do we ask, what links do we want to put in there, where would those links take families to. But we've also engaged with our co-production with our families group to see what they thought of it. They've looked at it, they liked it, and they've given us feedback on questions that we might ask. We're at that probably still early stage, well, not early, mid stage of development. So once we've finished the first draft, we will go back to that family group again and say, okay, have a look at this now, have a test of it, see what you think of it. So yeah, we are doing it in co-production.
I think one of the things that came out of our task and finish report was the directory at the end of all those fantastic organisations that were involved in the road shows. And is that information going to be accessible? Is there? I imagine that there will be signposting to some of those organisations, but as a directory of early help organisations within the county, would that be available on that assessment tool?
I'll just come in there. So currently the directory that you're talking about is now part of the integrated front door. So that's been part of our Families First. We haven't changed a lot in MASH, but it's now called the integrated front door. That is updated still at the front door. So we're just updating the links at the moment. So yes, I think definitely. So what we'll do through the programme is that those links that are on the directory will be the things that families are signposted to. So that's what I'm working with the design company now about, is that's our directory, and what we need the system platform to do is if certain questions are answered, then it will take them to that part of the directory. Does that make sense?
Yeah.
Yes, we are developing a directory through the family hubs, but clearly we need to just make sure that they are consistent and that people aren't having to kind of click through several different layers. So there is a whole kind of family hubs web page in development, which is going to be by kind of age and stage. So there'll be different partners for some of the specific things that are services for family hubs, but there'll be really strong linkage with the Families First partnerships because we want to ensure consistency right across.
I mean, yeah, that would be great. So Councillor Proctor and then Councillor Davis got a question online.
Just because we have now stumbled into a data issue, but and this isn't really a council thing, but what you've just described is the potential to have at least two separate databases of basically the same thing, and I hope that you'll be making sure that there is a single database that right, that's
Okay, Councillor Davis.
Yes, thank you very much. I'm just wondering about what is there available for parents that are being abused by their children? Is there special leaflets? When you do your roadshow, is there anything for a parent to pick up and take away with them? I mean, it's a massive thing to actually tell somebody that you're being abused by your 7-year-old or 10-year-old. I'm just wondering, what is there for them, please?
I haven't got in front of me the different services. I don't think there is a specific commissioned service for if you are experiencing harm from your children, but it's definitely part of the work that we do when we get involved with families around relationships, managing relationships, the level of risk, behaviour management. It's part of parenting programmes. So those are things that are addressed within programmes that parents can access.
However, but if the family hasn't actually been forwarded to you, I mean, how do you find out about these parents? I mean, because they're sort of like hidden, aren't they? They don't want to accept that this is going on in their homes.
If the family come and ask for help, whether it be through social care or through their school or their health visitor, then we can work with them and direct them to the parenting programmes that are available to them. If they don't ask for help, then you're right, they will stay hidden. I guess all we can do is encourage parents to ask for help if that's what they're experiencing.
Is there a number they can phone? Sorry, is there a number that they can phone, like a self-help? No?
No, not specifically for you're experiencing harm for your parent, but you can phone the front door and say, I want to talk to somebody about the challenges I'm having in my child's behaviour. You can speak to your school, you can speak to your health visitor, you can speak to anybody that's involved in supporting your family, and if you speak to somebody about it, then they can find for you, you know, who can do either direct you to the parenting programme. I mean, obviously the parenting programmes are advertised, or they can talk to you about, let's understand what that looks like, because there will be a wide range of that, and who is the best person to help you either get protection, you know, at this far end, extreme end. You know, it could be protecting the parent. At the other end, it could be relationship based, or in the middle, it could be management and understanding of a child's behaviour. So there's quite a range of things that could be the cause of that child's or young person's abuse of that parent. Right up to, I suppose, at the most extreme, which we absolutely do recognise sometimes, is physical assault, financial abuse of parents by young people, 16, 17-year-olds, which may actually involve criminal activity. So, you know, that would be the highest end and the last resort, but there is a wide range in there that we would want to understand and talk with that parent about. What does this look like? And then, as I say, have the appropriate intervention, whether it's a parenting programme, relationship-based piece of work. There are options within that. But you're right, it takes that parent stepping out and talking to somebody about the experience and the problem that they've got.
I think Victoria had something she wanted to add.
Yes, thank you. So obviously there is the targeted support available for situations where parents are experiencing child-to-parent abuse. We've got our chat helpline, so parents can ring in during working hours and get support through our chat team, Children's Help and Advice team. But I also just wanted to flag that we also do make referrals to PEGS for these parents that are experiencing this situation. So that stands for Parental Education Growth Support. So that is a specific service that is available for parents experiencing child-to-parent abuse.
Thank you very much. I think Councillor Davis raised an interesting point about those people that are under the radar, and so I imagine from what I've heard in the task and finish, etc., that this whole development about relationships and relational working, and that link with the schools, developing a closer relationship through the schools is really important in gaining the trust of families to be able to come forward and say, actually, I have got an issue around this. And I think, I mean, trust is a very big word. And I imagine that a lot of this programme is about developing that trust within a safe environment. Is that right?
I think that's exactly right. And, you know, that families being able to build a relationship and confidence to tell when they're experiencing difficulties, and to know that that person that they've spoken to could be the person that holds their case, holds their assessment, and then helps them through that difficult period, is a really powerful thing for families to know. Rather than knowing or feeling that what that professional is going to do is refer them into children's services, because for many families that's the last thing that they want. So that communication we've been doing with families around, your school can be your family help lead practitioner, your health visitor, your community worker, anybody can be your family help lead practitioner. So you're absolutely right, that confidence of, oh, if I tell my school, they can be this and I can talk to them and they can help me have my support plan. Over here, we've got our professional services supporting that person to be the family help lead practitioner, but families' experiences, it doesn't mean necessarily referral into children's social care. What's also important though is our improvement journey, and that message and that report that came from Ofsted was very clearly re-emphasising children's services in Herefordshire as a strength-based, relationship-based service that wants to help families. So even if you are referred into children's social care and you have that assessment, you know, all of our work has been about giving families that message that even when you're referred into children's services, our starting point is to help you be the best parent that you can be, to promote the welfare of your children and protect them from harm. And we will help you to do that. And if you can do that, we will then help you to do that, and then we will end our intervention. And that was a change from the experience, I think, more historically that families in Herefordshire have had from children's services.
Thank you. Right, Councillor Proctor and then Councillor Hitchener.
With your permission, I'm going to move us slightly into a different, so that get a little bit granular, to talk about training. So I'm slightly triggered when I see a number appearing without any context. So there's 170 practitioners have been trained, but I don't know if that's, we expect 170 to be trained or 3,000 to be trained. But it also, so it would be nice to know that, or have some sense of, like, is that a lot of a big proportion? But also, when we were doing the early help task and finish, we found in some bits of the system people reporting that they don't feel that they are released sufficiently to go to take part in the training that they would like to take part in. So I don't think this is within the council, this is across the system. So do we have a sense of bits of the system that are not participating in the training we'd like, and how we're addressing that with partners?
Okay, so I put 170 in because that's how many we've trained so far, but I can't stress enough, that's an ongoing training programme to partner agencies. So of course we haven't covered everybody in schools or in the community, but what I can tell you is September and October, I think we've got another 6 training courses fully booked. So it's definitely out there that what people have realised is this change is happening, and from their senior leaders in their schools, in their communities, everybody's got behind it and they've been asked or signposted to the training to come along and find out for themselves. So we've got sessions 1 and 2 that are running in September, October, and for however long they need to run, because this is big systemic change really. Yeah, that's just over the last 4 months that we've trained those people. But I would imagine by the end of this year we might be nudging nearer to. I don't want to give you a figure because then that becomes an outcome, doesn't it? But there are many practitioners who are booked on the training and will be able to attend. And for health partners, we find mostly at the moment it's schools and some of our community providers. So we've had on-site advocacy we met with yesterday. So when they can't attend the training, my team are, and we have to look at whether this is sustainable for us, but we're definitely doing it. We're going to team meetings. So for health, we realise that for some of their practitioners, they can't come to certain trainings at certain times. So we're going to their team meetings. I've been going to the DSL meetings, and then that's filtered down through the schools. So I'm not worried that we won't have the majority of the workforce working with children and families in Herefordshire trained in family help, because the demand is there and we are responding to the demand. But yeah, it's majority schools, community partners, drug and alcohol services, and we've got bespoke sort of little packages that we're offering to health partners who can't quite make the training. And we'll continue to do that as long as we need to. Does that help?
It does, and it sort of taps into a related question I had in my mind, which was the kind of family help lead practitioner role.
Yes.
I think we, and I think you have kind of we've focused a lot on the changes that will bring to schools, because that's what schools are obviously absolutely key, but schools aren't the only professions that will. And so, do we have a sense of? So you've done a lot of work to kind of address what might be the barriers in schools, but do we have a sense of what other professionals might perceive as barriers, and are the same things the things that are going to address their concerns, or are there specific concerns specific professions have?
When we did the survey, it wasn't just to schools, it was to anybody that may be a family help lead practitioner, and the training is open for the same. It's not mandatory training, and actually there are a number of different services and people who may not feel that they need the training because they have been doing that role. They've not been labelled of that, and they've not been doing it on their own, but it doesn't create the same level of anxiety, because they, if they, for many, it's specifically what their commission service or their particular service do, so they don't need to do that training. But as Dawn's described, we're able to say, how many from the education sector, how many from the health sector, how many from the voluntary sector. We don't go every single voluntary organisation, have you attended training, or somebody from your service attended training, yes or no. It's not that granular, but we are able to pick up overall 100 people from education, 100 people from health, which is how Dawn has identified that in those early sessions we didn't have as many from health, and we've been able to pick up why is that. And the health representatives at the steering group have said it's actually very difficult for health partners to be able to get around the table. Can we do something specific? And we will be able to do that, as the programme continues to roll out. And it will be a continued rolling programme, because organisations have turnover. So we will always kind of offer that as an ongoing opportunity.
And just to add to that, we are offering different times of the day. We're offering online. So, we've liaised with our partners in schools who said, mornings. For some schools, mornings are great. For some schools, after school is great. So we are just delivering it at the point of need at this moment in time, so that we can cover everybody.
And presumably over time, because this is something that is changing across the country, this will become more normal for every profession. And so as people move around, they will expect this to be the way that they work, I guess. That's
okay. Councillor Hitchner.
I'm going to be a bit rambling, so I'm going to tell you the question I've got at the very end, but I'm going to tell you at the beginning. So we had a briefing the other day about the Education Act. And there are huge changes in schools, and EHCPs, what's the future of all those? So we've got this huge change there, and we've also got this families first thing. The two things are happening at the same time, and they're both in your portfolio. But Tina, So you're able to cover both parts. But when there is so much change going on in an organisation, there are obviously risks and great opportunities. So that's the question. You know, how are you dealing with those two changes going up? But so my sort of rambling bit is more about sort of partnership and how important it is that partnerships are working together, and it's the way as a council and as a community we can benefit. So we've got the local authority, we've got police, we've got education, we've got the NHS all working together, and the more we can work together rather than working in silos, the better. And we did the work as a committee. We did the task and finish group looking at early intervention, and one of the things that really struck me was the key role the schools play. That it's the head teachers in our small communities who know what's happening with families and that sort of thing. And so working with them is so important. So hence this concern about changes happening in schools, that happening at the same time as we're kind of relying upon them. So the themes are sort of partnerships really important. I think early intervention, we all want that. We all want early help. There's also a recent report from the CCN, County Council Network, which if you want any kind of verification of the work that you are doing, and you want a very simple thing which says, you know, this is why it's so important. It's called From Prevention to Connection, Working Towards a Multi-Agency System that keeps more families together. And the picture they paint is if we don't keep families together, then the costs are just going to go up and up and up and up. But if we intervene and work well, you know, at least in the next 2 or 3 years it'll be stable, and after that it might actually go down. And that report was commissioned by the Society of County Treasurers, so you know it's finance. So I do commend that if you want to have a look at that report, it's got some really good short charts, lots of good information and data supported. My question was about, you know, these big changes taking place, not just what we're talking about now, but also education. Tina.
So I'll answer you the question backwards as well. So I'm glad that you made the point that was a finance committee led report, because yes, the sideline benefit is that the costs to the system will reduce if families get a family help. For us, the primary benefit is that we know it's better for children if they can stay within families and be brought up by parents who are able to promote their welfare and protect them. We know that the outcomes for children once they are received into care are much, much more difficult. So for me, it's about getting it right for families and supporting children to stay within their family or their wider family. That's what works best for them. But you're absolutely right. The costs, of course, are also change as well. In terms of, you're right, they are both under my portfolio, which is great. That's not the same in every local authority. Sometimes they have different directors for education that they do to children's social care. We've been on a journey in Herefordshire. I meet with my senior team of the service directors. So you'll all know Liz Farr, Rachel Gillett and Tori Lynch, and they all have independent sort of arms of business that they need to take care of. And I'm, you know, forever daily grateful on how competent they are individually. But what it's been important for me to do is to make sure that we bring the groups together. So under each of those 3 service directors, there is about 14 or so service managers who, again, you know, have their own bit of the business. So at the beginning of our journey, I used to meet with these 2 groups separately because we needed to do the business and the detail that was relevant to them. There's nothing worse than inviting 25 people to a meeting where 15 of them it's not kind of relevant, because you risk disengagement. People don't turn up, and even if they do turn up, they're not really listening. So we've been on that journey. You will have seen me last time present the business plan for children's services. That was a huge step forward for us as coming together. And we've now got a programme of meetings where Liz, Rachel, Tori and myself, we meet with all of the service directors across both sectors on a 8-weekly basis. And at that section, strategically, we talk through what's happening through each part of those plans, the council's delivery plan, including Families First, the capital investment, right through to the Education Act, what's happening in schools, not just in the SEND reforms, the SEND reforms, the regional plan, and we talk through all of those so that that whole group of people are informed and cited on what's happening across. That then filters down to some really good cross-sector working. So in the children's social care, as an example, we've got Jess Davis, brilliant service manager over children with disabilities, works incredibly closely with Hilary Jones and Michelle, who manage our SEND services. And we've had an opportunity, we've had social care workers seconded into alternative provision to make sure that we can support those alternative provisions who are undertaking assessments for EHCP, for example. So really making sure we strategically connect those people, we inform our team managers so that they're connected, and take opportunities to cross the service together. And we have every 3 months, I think, might be bi-monthly, staff meetings of the whole of children's services, one in person, one virtual. And that's an opportunity for us as strategic managers to make sure we deliver to the workforce what's happening within children's services across the piece, really. So I think at all the levels, I feel very confident that we've got good processes in place to get people to work together. And then, of course, there's mini groups like Lynn's. You can see the group here. You know, Dawn's our lead on Families First. Lynn's is our lead on family hubs and the youth offer that we're developing, the youth strategy. And Vicky is one of the service managers in our family help teams. So they will meet regularly to connect, to make sure everything, you know, what's happening in your world, what's happening in my world, what do we need to do? So yeah, I think we've really got that. I think we're probably a very, very good example of how that works in a big organisation, actually.
And I think Councillor Hitchener's question also kind of alluded to the responsibility on schools. So if we can just focus on schools for a little bit, obviously with a rural county, a lot of our schools are in kind of very rural locations, and from what I perceive about this approach, going for localities means that there's better access to those services in the north and the south of the county central. But that responsibility on schools come September is actually going to be huge, given the changes in both the SEND stream and this Families First. So that you know, what assurance can we give to schools that they're going to be supported through this journey? And if you can just speak a bit to that, and then also about the localities that change to localities, how that will help the issues around rurality and access to better support and services.
So I guess my first response would be that we have very openly, I mean, this is the kind of a number of meetings where I talk openly about recognising the pressure on schools. I think the recognition of it is a key thing. It is the SEND reforms, it is Families First, it is also the Schools Act reforms. You know, there's more in schools, not just the SEND reforms. Liz Farr and her team do an excellent job of meeting regularly with the primary network, the secondary network, the FE network, the head teachers network, the DSL network. So she regularly and goes out to individual schools, as do her team. So regularly is getting that feedback from those people as to how is it working, what are the challenges, what do we need help with. So that's very much in place. As I say, you know, we have been very aware of the need to offer that practical support in terms of capacity, not just the risk management element of what's happening in the family help programme. Same in Liz's sector of the directorate, helping schools with those quality assurance changes, the inclusive agenda, what does that look like? How can we help you as a school to meet those expectations that Ofsted will be looking at when they come and inspect your school? So Liz has a great team of people that go out to schools to do that work with them as well. And in terms of the locality, what the locality does is, and you know, we moved to locality a year and a half or so ago. Time flies, probably 2 years ago. You know, we've developed locality family help teams under the Families First programme. What that has built on is what we've already had in place, which was the locality development, which we did as part of our improvement journey. And that was having teams of social care practitioners in the north, the south and the central. Those teams still exist. They've become family help teams, not just the children in need teams, as it were. But the benefit of the locality is being local and having coordination, better coordination and communication. So the family help teams, the assessment teams, MASH as well, have been able to hold coffee mornings in a locality. Come in and meet us, come and see. And I know that's something that schools have taken up and really enjoy, going to, you know, dispel the myths and whatever, as who sits behind that telephone when I send in my referral. So we've been able to do that better in locality areas, as well as have those, you know, Lindsay, as I say, developing in that the family hubs model. What's happening in that locality? We've got HFOS heavily involved, working with us in terms of what's happening with the voluntary sector, but not the voluntary sector in Herefordshire, which we do get from them, but also what's happening in that locality around the voluntary sector. How can we connect those people? How do we make sure those staff in the schools and children's social care know what's happening in their area? Then you go right back to the directory and what's available in the family hubs. So it's making sure that you connect all of those things, coordinate those connectivities from, you know, all of the different levels, I think, within the service.
I think one of the issues around schools, and that schools are really well placed to support families. Obviously, the best place to support them. Certainly, in recent years, it's become more sort of difficult for members of the public, etc., to get into schools physically because of the safeguarding issues. When we were having our lines of inquiry, there was a discussion around that about how, and this will come to family hubs when we speak to Lindsay. The two sort of topics morph into each other really well. But it is sort of, is it likely that we're going to just have to have a revision within schools about how those schools become sort of local hubs? For example, we had, in my local village, we had a talk community hub, and we put on support for families, but actually families didn't come to that because they gravitated around the schools. So it just a point to show how important schools are in actually being able to provide that sort of activity.
I think what I would say, maybe schools will support this or maybe challenge it, I don't think they'll challenge it, is that with all of these changes, first and foremost, schools are where our children are educated, and they need to protect that as a primary role and responsibility, that they are delivering good quality education to our children and inclusive education. So the additional work around family, being a family help lead practitioner, the meeting with families, yes, you will have some families that meet within the school and gravitate to the school. That happens a lot more in the primary school sector than it does in the secondary school sector. But even in the primary school sector, sometimes there are families who don't want to be turning up to meetings at the school. They want the help, but the school's there and my child goes to school. And we will, that ability to have that information, have those meetings at your local family hub, needs to be something that's available to families as well. So without saying case by case, because obviously we can't, case by case, it's very difficult, isn't it? But generally we are recognising that, for the different age groups and for the different families, whether you want to gravitate around the schools or the family hubs, but I guess what I'm saying is, in answer to the question which I think you posed, is will schools become family hubs? No, I don't think they will. I haven't asked anybody else their view on that, but I don't think they will, because I think that they do need to protect themselves as the educational establishment. There may be things that they do, we've already got the breakfast clubs and the after school clubs, but that's very different to family support within a family hub, I think. So I think that we need to make sure our family hubs are places where people can go, can get information, can get advice, can have meetings, because I don't think it has to always be revolving around a school premises. As I say, I think that's different to different degrees, whether you're primary or secondary as well.
Okay, thank you. And Lindsay, we'll come to you about family hubs. I just want to ask the committee, does anybody else have questions specifically around Families First? Here we go, this one. Okay, so how will the programme demonstrate improved outcomes for children and their families rather than increased activity? No, it wasn't, it was the voice of the child. Sorry, we did cover that previous question. Right, so how are children and young people influencing the programme design, and is the programme responding to young people's concerns about how they feel safe in their communities, and will children's experiences be reflected in the decision making and evaluation?
So we, like I said, our quality assurance programme that we've had in place now in children's services, we ask children and young people about their experience of the assessment, about their engagement. We will do the same within the Families First programme. So there will be a selection group of young people that we speak to. We are developing our questionnaires for children around meetings. So whatever meetings they are, whether it be a care planning meeting, whether it be a team around the family meeting, I want us to develop the gathering of children's experiences, and we're doing that at the moment. We're using a platform called Momo, Mind of My Own, which we're looking to implement, but before we've agreed to implement that and to pay for that, we've wanted to check that we have sufficient flexibility to design our own questions and not just be restricted to off the shelf. We've now got confirmation that we have, so we're just kind of tweaking that. We've got our our participation team. So whilst we're developing kind of the questions to ask young people, how did you experience your meeting? We will have the ability for some children, they will be able to fill in that form or that, and it's not a form when you look at it on Momo, it's a interactive way of describing what you think. We've also used our participation team as the plan to contact children, to speak to children after a meeting or by telephone as well, or virtual meetings, to ask them those questions. So it's not all we've designed a questionnaire and we're sending it out. We already ask children, as I say, as part of that, what difference has the intervention made to your family? Do you feel safe? Do you feel happy? And these are the questions that we're building in, asking a selective group of children and young people, as we currently do. So we'll be able to, as I said earlier, monitor what we're getting back there with what we've already received over the last 10 years. 2 years, 10 years, 2 years. I must have a 10-year plan in my head. For some reason.
Feels like 10 years sometimes, I imagine. But, okay, excellent, thank you. Any other questions on this? I'd quite like to move directly into the early help task and finish the work that we did. If everybody's all right with that, does anybody need a quick break? No, let's just carry on, because as I said, they, the two topics segue neatly into each other. So that is item 8. If I just set the scene, so the Scrutiny Committee established a task and finish group, which came out of the request for a inquisitive inquiry into early help. We've talked a lot about early help over the duration of this committee, and about the provision across Herefordshire to assess how effectively children, young people and families were supported before difficulties escalated and required statutory intervention. So the review examined the full early help landscape, including Families First, Families Hubs, locality-based services, schools, health services, youth provision and support for young carers, commission services and community development. And through engagement with the council services, health partners, schools, voluntary and community organisations, the committee explored both the strengths of the current offer and the challenges facing those delivering support. The group found strong and continually developing early help system, which was underpinned by committed partners, effective multi-agency working, and a shared focus on helping children and families thrive. Significant progress has been made through service development, such as Families First and Family Hubs, which provide a solid foundation for a more accessible, coordinated and preventative approach to support. So we've got both Lindsay and Victoria Leader here. If I thought it would be really helpful if you could just speak a little bit, maybe Victoria first and then Lindsay, because Family Hubs is developing out of that, about the work that has been identified in this report and the sort of process of the journey of early help. Victoria, if I pass on to you just for a synopsis.
Thank you very much. So I was the service manager within early help until recently moving over to the family help service manager for the North locality. So I did receive the report yesterday, and it's really helpful to see the strengths that were identified. Certainly in terms of kind of the journey for family help, which we've moved into, we were already in the locality teams, as Tina's already mentioned. So we moved into locality teams last spring. So that was a good amount of time we've had within our teams. We've been through a management of change process, as we've already heard, which means that we are now in our family help teams in each of the localities. That has required some workers moving, but we've got 4 teams within each of the locality areas now. One which is led by an alternatively qualified team manager, and 3 teams by a social work team manager. So a lot of work has been completed to establish those teams. In terms of training, which has already been alluded to, we've had training rolled out, and it's still happening as we speak. So we've got 4 different sessions that are being offered, and that will be a continuing process. So we absolutely need to identify what the gaps are for our staff, and we'll be identifying that through my conversations and rolling out that training going forward. So in terms of the family help assessment, which has already been talked about, we have piloted that within the service as well. That's been going on the last month, with 4 different teams have been trialling that, and obviously families have been involved in that process too. We are ready to roll out the family help assessment from the 1st of August, which is really positive. And we've talked already about the self-assessment, the pre-self-assessment, but as part of our family help assessment, we have got a self-assessment form within that, which means that parents and children can contribute to their own assessments, that family help assessments, and they can do so electronically also. So that's a real positive step forward, and we've had some really good feedback from the families that were involved in the pilot in terms of photographs being included in the assessment. They've really enjoyed that. Workers have fed back that that's been an icebreaker to start the assessment process with the families, and they've certainly enjoyed being able to contribute to the assessment through the self-assessment part and having their own words included within that assessment. So that's really positive, and we're ready for the 1st of August. But as I said, there will be further training that takes place. In terms of the locality areas, they are established. We've got the multi-agency office in Leinster. Obviously, everybody's all together there. We've got the Ryfield Centre in Ross, and also we have Plough Lane here for Central. So overall, it's been going really well. We've established some guidance to support us with the allocations process as well. So obviously with Families First, families will either be allocated a social worker or an alternatively qualified family support worker. We've got guidance to support team managers with those decisions, and that will be very much based upon the levels of need, threshold document, but also the presenting issue for the family when they come in through the integrated front door, and also the history in terms of social care intervention. So yeah, that's kind of my update, really.
Thank you very much. And I mean, one of the discussions that came during the task and finish was really about how complicated the referral was, and that often people were in schools, for example, were using a kind of social care referral rather than an early help referral because of the complicated nature of the form. So I think what I'm hearing is that has been heard and remedied, and that the process for somebody being sort of assessed for early help is a much different, it's a more different process to what previously went. Is that right?
So professionals will be expected to submit a MARF, a multi-agency referral form still through the integrated front door. And obviously they will have hopefully completed a family help assessment too, which will feed into our assessment. So it is more streamlined, and the portal, I think, is that going, Dawn? Apologies, you can come in there.
Yeah, that's fine. So yeah, I think one of the biggest feedbacks from partner agencies was that the portal wasn't responsive. So now if agencies are sending in their own family help assessment that they're leading on, they don't have to send it through on the portal. Now it's coming through on any comms into my team. So people are really happy about that, let me tell you, because it's much easier for them.
That did represent a significant challenge in terms of technology, because very often we would have feedback that partners had written their early help assessment and then lost it on trying to submit it through the portal. So that is definitely a breakthrough for us, definitely.
Okay, excellent. Thank you, Vicky. Does anybody have any questions for Vicky before we move on to the public health aspect of it, which is Lindsay's area?
Would you like me to talk about young carers? Because that's all.
Yes, please do.
Yes, because that's my other area of leading. So we are. So I know that was considered in the task and finish group. We have absolutely progressed the No Wrong Doors for young carers, with a plan to launch that on the 1st of August internally, and then externally from September, because obviously we're aware that schools make the majority of our referrals, so we want to wait until they're back from the summer break. As part of the No Wrong Doors, we've implemented a screening assessment, which actually will be a mandatory requirement for any practitioner completing a family help assessment. So the screening tool will basically set out what the care and responsibilities are, if there are any, for the young carer, and will also guide kind of the next steps for that young carer to receive the relevant support. So it provides a really clear and robust framework in terms of the pathway of support for the young carer. And if they are providing moderate, very high levels of care, then we'd be referring them in for a young carers assessment and a family help assessment. So that's our plan. And we've got various training opportunities coming up for that. So we are delivering internal training, obviously, first, because we're launching that internally on the 1st of August. And then we have a launch planned for September the 21st for our external partners. And then the training will be ongoing alongside Dawn's Families First training, so that it's delivered as part of that process.
Thank you. Vicky, one of the things that came up about young carers is that there seem to be quite a high level of under-reporting in Herefordshire. So do you feel that sort of these changes will tackle that, and that young carers who are under the radar we will start being able to find out more about them and how they can be supported?
Absolutely. I mean, that is the purpose behind the No Wrong Doors. It's not just a Herefordshire issue. This is across the board in other local authorities that have experienced the same issue. I've worked very closely with Leeds, who are our improvement partner, and they've established the No Wrong Doors and developed some tools that we've been able to implement ourselves. So very much with all of the increased publicity, training, just recognition, hopefully will improve the identification and therefore support for our young carers.
Okay, thank you. Councillors, does anybody have any questions for Vicky on the early help bit? I think what we would like to do is, before this round of the scrutiny is over next year, is just get a report back on how these changes are sort of bedding in. So, possibly sort of February, March time, it would be good to have you back. So part of that review also, we looked at the increasing levels of need, the workforce and funding pressures, the challenges associated with rurality and accessibility, and the need for continued improvement in partnership working, data sharing, service integration. And while those challenges were significant, the group really felt that Herefordshire was well placed to build on its strengths and continue improving the outcomes for children, young people and families. And part of that discussion, the really quite exciting part, was also about the development of family hubs. And Lindsay, I know I did mention public health because I know that you've come from a public health post, but you're no longer, it's not a public health post, you've moved into children's, haven't you? Would you like to explain your role and then also the development of family hubs?
Yes, thank you. So yes, I am still a public health principal, but I am now sitting within Children and Young People's Directorate, reporting directly to Tina. And part of the reason for that is because this is a joint initiative, Best Start in Life Family Hubs and Healthy Babies, between the Department for Education and the Department for Health and Social Care. So there are some kind of responsibilities from the Director of Public Health, because it also includes good level of development targets that we've been set nationally, but also specifically for us as a county. But in terms of kind of direction of travel, making sure that it fits with some of these other developments that we've just been talking about, in terms of early help and families first partnerships, it made a lot of sense to be sitting directly in children's, so that we've got that strong kind of interlinkage and cross-referencing. But it doesn't mean that I've kind of left my public health colleagues behind, and certainly I've been heavily involved over the last few years, previously as the lead for children and young people, with a team underneath me within the public health team, in developing the contract for health visiting school nursing service that we run. Sadly, public health isn't responsible for the midwifery contract. That's an ICB responsibility, but we have worked really closely with them, and so I've brought some of those relationships with me as well. So I've got really, really strong kind of ways of working and developing family hubs with some of these teams and services that I've historically worked with. The same is true of the sexual health service and also the substance misuse service, which public health is also responsible for. So all of those I'm kind of nurturing still, with a view to the youth development work in particular, but also there are some specific elements that I think will be important for family hubs. Is that okay? Is that clear? Yeah, okay, thank you. And my kind of move is for the 3-year funding period that we've got to support the development of family hubs. So there was initial fund made available in 25-26 at the end of the year, but then the kind of the main tranches of funding really are from this year, 2026 through to 2029. And similarly, with good level of development, we don't have any money for that, but we do need to be reporting in the academic year ending 2029. So there's kind of it's a really kind of big piece of work that needs to dovetail very closely with other things that are going on, and that's part of what's exciting about it, because it all feels like, yes, there's a really good opportunity. You know, sometimes when you get some money and people are already busy doing things, and it's really hard to break through. So it's really exciting. So I seem to go around with a team of people, because the early officers, public health staff, there's the Healthy Tots and Healthy Schools programme that's operated through the public health team, which supports very specifically the early year settings, but also our primary schools, and it will develop into secondary schools. So yeah, it feels like I'm constantly talking and meeting with different folks all the time. In terms of the actual development around family hubs, it's been quite a proscribed programme, and encompasses, but it does encompass quite a wide range of initiatives and activities that we need to make sure are in place. So previously, where we've had our children's centres across the county, they are becoming family hubs, starting with Wide Marsh, which was our kind of flagship family hub that we launched on the 1st of April, and I'm still conscious, Councillor Proctor, that I haven't invited you, but I promise you it's on my list. I want to make it beautiful and perfect. So the other children's centres will come on stream over the course of the next few months. We've deliberately staggered it because there are very specific services that need to be in place in order for you to be called a Best Start family hub, and then they're not all quite at that point yet. Partly because some are very small and aren't open every day of the week, and partly because they're not in the same kind of centres of population as Wide Marsh is in Hereford. But we're all very excited, and we're working very hard to get them kind of up to speed and ensure that the services that we need to offer are going to be able to be offered within the next few months. So the kinds of things that we need to make sure are being provided are around parenting support. So that's right through from prenatal, from preconception, but also through pregnancy, right up to, well, actually the family hubs are for children aged 0 to 19 and up to 25 for those young people with SEND. Currently the focus from government is on 0 to 5s. Very, very specifically on 0 to 5s, and the funding is very specifically being directed to 0 to 5s development. So in terms of the parenting support, it's things like infant feeding, signposting to services, being available to mental health support, specific activities potentially for those groups who are currently underserved. So we don't have a very good offer at the moment for, say, fathers. So we'd like to be working with communities to say, would a dad's group here be helpful? Similarly with some of our young people, I noted in the report that because we're reviewing first steps, we need to be thinking about what we might be doing for our more vulnerable young people. And certainly we think that there'd be a place for having some young people specific kind of parenting support going on. Then there's also a very, very strong push around home learning, and that links very much with the good level of development. And by that I don't mean home education. It's not elective education. We're still talking about 0 to 5s. It's very much about a home learning environment. So it's about don't use your mobile phone, trying not to use apps and things. Actually, it's about talking, it's about being physical with your child, it's about play, it's just all about all the kinds of development activities that parents can do quite naturally with their children, but maybe need a little bit of encouragement and support around. Yeah, this is a good thing to do. Don't be shy to do it. Yes, actually, go outside even if it's wet and horrible, and talk about, splashing through the puddles and crunching through leaves. And it's very much about communicating with your child, actually reciprocating to what your child is kind of trying to tell you or wants you to do. And it's really quite exciting, actually, because when you see some of the studies and some of the responses that come through around some of the impact of really, really small, silly things, bash a saucepan, sing a song, do something silly. It's really quite refreshing, I think, for parents to be told, yeah, just go ahead and do some of this. But there are evidence-based programs that we've been encouraged to use, so that we will collect the data ourselves for what's having an impact. As I say, we're hoping that, going back again to your report slightly, where we've got our 2.5-year check and our new 3-year check that we introduced last year, and then the early years a good level of development, a kind of assessment at the end of reception, we're hoping to actually be able to start to see a bit of a trajectory, so that we're not early help, and we're not kind of the families first bit, but we're almost like prevention, really early intervention, and providing some of that support for parents before they might ever need anything further. In terms of some of the other specifics that are being offered, we've got an extended offer around speech and language already in place, but we're building on that. We've appointed a universal portage worker who will be going round, hubs peripatetic worker, to support those children who don't quite meet the threshold for portage, and to try and put in some interventions and support parents at a very, very early stage. So we're talking quite young children. We've got an expanded programme called Togetherness. It used to be called the Solihull programme. It's a parenting programme that we offer in Herefordshire and have for a number of years as a universal programme for parents. We would like to just, say this is the standard thing. If you're thinking about having a baby, if you've got, somebody in your family's got a child on the way, or they've got a child already, we would encourage everybody to do this programme because it's very much around responding to your child, but not looking at behaviour as a problem. It's around understanding why your child might be behaving the way that they are. So there's an antenatal programme, there's a 0 to 5s programme, there's actually a teenage specific one, both for parents and for teenagers themselves. There's one for parents with children with SEND. There are lots of different ones. And one of the things that, because we've been investing in it for a number of years, we've been able to develop some of the training so that schools, primary schools in particular, are very, very interested in it. But they can't, going back to the training question, they can't spend 2 days out of school, particularly not the smaller schools. So we've developed a bespoke programme which we can offer as part of a staff training evening session, which fits into their term schedule. And similarly with foster carers, we've developed a kind of bespoke programme as well, because actually our Togetherness lead is also nationally trained. So she is, called upon occasionally to go and offer trainer training to other counties. So we're very lucky to have that kind of very specialist expertise in the county. We've got Best Start Inclusion practitioners posts that we will be recruiting to. We're required to have one in every family hub. They will complement in many ways the work that's going on in schools around SEND reforms, and also complement the work that the portage team do kind of in people's homes. So we're thinking about this in terms of SEND and inclusion within the community, and they will be kind of working from the hubs but also across localities. So all of this work kind of fits across localities. We have got a number of hubs, I suppose, who've said, please, could we join? We'd like to be one. So Helping Hands, the hub for families with children with SEND, have asked if they could be a family hub. Bromyard are quite keen. The Hope Centre is quite keen. I actually have had a school teen who said they'd quite like to be a family hub. I haven't spoken to them yet, but I gather that they're interested. So for all of these, I'm not sure whether they would become kind of fully family hubs or whether they would become part of the family hub network, because I'm very keen to establish a network, because in some of my particularly more rural areas, we may want to have network sites so that people know where to go for some of the family hub support, but they would know that they wouldn't necessarily get the full range of provision. Sorry, I could go on and on and on really here. Library services, they're really keen. They're already offering stay and plays. The health visiting team are offering stay and play sessions, and that kind of straddles both the parenting support but also the home learning kind of work. We've got midwives and health visitors. I'm probably going into your recommendations now, but we've got midwives and health visitors who are very excited about doing things differently. So they're not just going to be offering antenatal classes, for example, separately or in hospital settings, but they are already, they're planning with me how they can deliver in each of the hubs antenatal classes together. And that would be something that can be maintained. That doesn't actually require any additional money. It doesn't require anything except to think about how to do things differently. which is very exciting. And we've got, I've had a request from West, from the school's mental health team, to say, please, could they use the hubs through the summer holidays, because obviously the schools are closed. They would like to maintain their one-to-one appointments. Victim support have contacted me to say, could we hot desk in the hubs? So I think some of this, although we'll have 5 definitely, and I think we will have some network sites, I think we will also build on this really quite quickly. So as I say, from the 1st of April to this point, we have got huge plans in place. We have a well-devised, developed delivery plan that is being led by a Family Hub steering group, and yeah, the enthusiasm for it, the potential for it is just amazing. And I know that the question is going to come around, what do we do when the funding stops? Because I raised it as well myself when I talked to you before.
Yeah, so and it is a really, really good news story. It's a fantastic opportunity, and what we know in Herefordshire, just like everywhere else, is that children have suffered in sort of that COVID time and post-COVID in being ready for school. So there's been an issue with children not being ready for school, and we know that there've been issues around resilience, both for within children themselves, but also with families, young families. So being able to support families in that way is really exciting. But how do we make sure that that's embedded, and also the workforce issues, because there are there's an increase in the need for different sorts of practitioners, and with that opportunity as well. So do we have the workforce capacity, and are we building in sustainability so that in 5 years' time, it's suddenly not seen as low-hanging fruit that we can sort of pick off family hubs because that's too expensive to run. Because we all know the consequences of not providing that support early on.
Yes, I absolutely agree with that, and recognise that there are some potential problems with employing a whole range of new staff. We are required to employ Best Start inclusion practitioners. Whether or not there will continue to be national funding for those to continue, I don't know. There are some other posts where we have got funding, and we will need to just look at those over the next few years to see what kind of impact they're having, whether or not they could be done slightly differently. So we will be looking at all of those things. In terms of existing contracts where we've put in a little bit of additional funding, say for the health visiting service, for the stay and plays, the health visiting school nursing contract is due to be renewed in 2029-2030. So actually, by the time we get towards the end of this programme, I will be feeding into, or going back to my job to feed into, the development of a new specification for that. And if we have, found that actually these are some of the things that have had the greatest impact over the last 3 years, then I would be making a stake for saying these need to be included in the new contract, whether there's additional funding available or not. But that would be the kind of recommendations that I would be wanting to make. In terms of some of the other things, because I have been thinking about this quite a lot, trainer training is something that we really want to focus on. There are some programs, the evidence-based programs, where they don't offer trainer training. I think that's very limiting for us. We want something where we can train our own staff. We can then, train other staff. So actually, we are building our own, if you like, in terms of workforce capacity and development. Thinking about new ways of working, not just midwives and health visitors, but the libraries. They stuck their hand up. We'd really like to be involved. Not cost us anything apart from a few resources, which is very, very, very small money. So they're very keen. Thinking about using some of the existing programs we've got. So I mentioned Healthy Tots and Healthy Schools. I actually think that if there is some good practice that we can see coming through, I would want that to be continued through programs that are already funded through the local authority. So we know they're working really well with the early years settings. why not continue some of this other work? And I certainly want, things like the supervised toothbrushing and work around childhood obesity that's already kind of happening through those programs. I would expect them to continue through the family hubs. Community involvement's been really important, and Leominster Hub has recently celebrated opening a garden at the hub. There was a bit of a launch there, mostly made available and possible because Leominster in Bloom stepped up and said, we'd really like to help you develop your garden. It was a very rundown, overgrown, horrible space. Other community groups got involved, local businesses got involved, gave away, wood, tyres, all sorts of things. So there are now wet play areas, sand play areas. There are little bug boxes. There's pots and pans hanging on the fence for music. There are flags, flowers, materials. There's all sorts. They're growing vegetables. I mean, it's a lovely, lovely space, and that is definitely, I would recommend if people would like to visit, not just Widemarsh, but actually Leominster, which I think will be our next hub that's opening. Is a really lovely one to go and see. So actually getting community involvement and community ownership and buy-in, I think, will be really important. And I haven't set up one yet, but parent carer panels are also to be set up so that we get the voice of parents and families to say exactly what they want, what they need, and how best we can go about giving them to them. And I think, I think that people are sufficiently responsive to this to want to continue developing things differently, and if they can see a way to do it slightly differently, then let's do it. And if we've got some initial money to help, then great, but with thinking all the time about how we can continue it without the additional funding being available necessarily.
Thank you. Tina, did you want to come in about something, and then Councillor Proctor?
Yeah. Just to reinforce, I mean, I think Lindsay has really helpfully set out, the continuation of the things that were funded through the grant was absolutely on our agenda from the very, very beginning. And Lindsay and I had a couple of discussions around, there is quite a lot of money in this grant, so we've got to spend it, and we can't only spend it on things that we know are going to have that permanent longevity. There is more than that, is available for that. So I think Lindsay set out very well how we will try to mitigate either removal or reduction of any further grants, or incorporate them. But certainly our position with some of the things that we won't be able to fund going forward if it's removed or reduced, what our position was that we will have given those services 1 or 2 years of delivery on which they can then evidence evaluations of impact and outcomes and service user feedback, which will then support them to perhaps access other grants or opportunities that could become available as well. So it's the balance of both. Some that there'll be other grants, and others we will be able to incorporate into a reduced family fund grant, and others, as Lindsay's described, make a case for within the public health ring fence grant that comes forward, what we want to, in terms of what we want to include as priorities within that grant as well. So I think we've tried to look at the 3 mechanisms for how we can give it longevity as much as possible.
Thank you. And I think, again, the argument is there that the money invested in providing that support early on is likely to be saved later on if you're avoiding escalation. Councillor Proctor?
Thank you. I have a couple of observations, suggestions, and then a question. So the first sort of observation is, I was thinking, when you were talking, I was thinking back to possibly the first Children's Scrutiny Committee I sat on, certainly an early one, where we were looking at the annual report from the Children's Safeguarding Partnership. And one of the things in there was that the No Wrong Door project had sort of run out of its funding and it had been closed. And Kevin Crompton, the independent scrutineer, cited that as a lack of maturity in the partnership, that the partnership, kind of the system, hadn't been able to get together and sort that out. And so it feels like this is a test of the maturity of the partnership now is how we collect, not we the council, but how we in Herefordshire deal with this. And it sounds like you're doing all the right things. That's great. Related to that, but partly because I have a background in social enterprise, some of the things you were talking about sound like potential kind of social enterprise opportunities. So if you're having trained the trainer people for our own purposes, that's something that potentially could be traded beyond, and so that's a thing to maybe explore. And then my question is, the family hubs are supposed to go up to 19, but the emphasis is currently on up to 5. So what realistically, what is going to be the post 5 offer, and how will that evolve? And obviously there is an interaction then with kind of schools, because obviously post 5 children spend more time in schools, and so how do we think that relationship will evolve over time? And just before you answer that, I would say we had a briefing about schools reform and that sort of thing, and they were talking about family hubs, about how they're linking that. So I recognise that these conversations are going on, but I would just be interested in this sort of post 5 agenda.
Yes, thank you. It's a bit frustrating, I think, for us that the focus is only on 0 to 5s, with absolutely no acknowledgement that they are expecting us to be thinking ahead. So we have been thinking ahead, and looking at how do we make these spaces spaces that are not just for kind of 5 to 10-year-olds, but actually potentially link in with the safe spaces for young people, and link in with the youth strategy. Certainly, I think things like West operating through the holidays from the family hubs starts to create a different kind of conversation, so that there's a bit more, there's a stronger link then already between the hubs and the schools. So that hopefully would be something that we could build on. We have looked at and invested with the Turning Point Substance Misuse Service for a kind of an outreach worker. Primarily that would be for to work with young people. It was the idea. But actually, the more I've thought about it, the more I've talked with people, to have that worker available in the hubs regularly actually would be very helpful for families too, who might have children who are over the age of 5. But we know that some of our schools have been reporting that there are children vaping within their primary schools. So it may be that there are some kind of potential offerings for families that have a different focus from 0 to 5s that are then going to start to be available. The Crisis and Resilience Fund, the new fund that we've got, I've already had conversations with them about could they have a worker to come in to the family hubs, so that we've got that kind of support available. So it's very early days yet, really, in terms of what do we do post 5 years old, but I'm very, very conscious that we cannot have this kind of cut off. And certainly in terms of families first partnerships, the more we've got staff working out of the hubs, the more families are familiar with them, and what could be offered. I think the more we can ask what they need, what they would like, and start to build that. But it's slightly awkward when there's absolutely there's nothing coming from the government at all to say, don't forget, you need to be thinking ahead, or actually we've got some money that might be available in the future. There's been nothing. So we're planning to build on them and to develop services for 5 to 19-year-olds until we're told, actually, no, we should just be focusing on 0 to 5s.
And if I just come in there just to support Lindsay saying how we've joined up with the Families First partnership. So my team actually deliver a rolling programme of parenting across the year in response to need, and as part of our collaboration is the Teen Triple P is going to be delivered in one of our family hubs, the Fearless Triple P, which is a course for children who between 6 and 14 who are experiencing anxiety. So we've joined up to make sure that we're delivering some of that from the heart of our local communities, and we'll continue to do so. So that's one thing we've done already,
Yes,
isn't it?
Thank you. And Lindsay, you mentioned the youth strategy, safe spaces for young people, and within the report there was a fair bit where we looked at youth services. Again, that's a national picture, isn't it? The sort of deterioration of youth services. So I just wondered if it's a good opportunity just to mention the youth strategy, work on safe spaces, and youth services. I'm not sure if that's specifically yourself or Tina, but you know what we're doing in Herefordshire to sort of address those issues.
Thank you. So yes, there is a kind of final draft youth strategy that has been developed through the youth forum that was set up at the beginning of the year, and that we kind of did a mini launch at the parish council summit last week because we also wanted to see if we could gauge interest from parish councils in terms of what youth provision is available across the county, whether there would be interest in taking forward youth worker provision, whether or not there would be interest in a sort of shared pooled budget approach, whether there was any budget available that we could, use that for. So we have got quite a number of the folks who signed up and said that they would be interested. So the youth strategy kind of will formally be launched in November. It's still got to go through a little bit more of a kind of consultation and just make sure it's absolutely kind of perfect, but we have a strong action plan for certainly this year, which includes co-production, consultation with young people about what needs to happen over the next 3 years. So that actually is quite an exciting space to be in at the minute. I'll let Tina come in.
Yeah, just to be clear, we've finished consultation. We're not doing consultation on the youth strategy. It is finished. It's just in design. So we're completing the design of it, and it will, as Lindsay says, it's going to be launched in November. We've got a core group of representative of the town councils, and we've also got some additional members on that group: rural media, HVOS, key agencies that have been involved in youth services to help us build that 1 year strategy. What Lindsay's referring to is that we will then spend the rest of this year and next year implementing that first 1 year strategy, and then we'll be engaging throughout Herefordshire children, young people, to inform a 3-year youth strategy. And as part of, we've got our central forum, but a bit like we've done with Families First, we want to then develop over this next 12 months local delivery forums, and that's why we're trying to engage through the town councils, but also through the parish councils, a local delivery arm of the youth strategy, and that will be the engagement of young people as well. So and safe spaces comes within that youth strategy.
Okay, and we will be looking at that in October anyway. Yeah. So we can just in terms of youth services, because we did we spoke to HVOS, and there's an attempt to develop more youth services, but any sort of update on youth services in the county?
So not in terms of detailed. I mean, we're already across the local authority and also the jointly with the PCC funding a range of youth services. Obviously, looking at how we can continue those. The National Youth Strategy that came out in December, at the end of December last year, is the first strategy that's been developed nationally for, I think, 10 years. And it comes with lots of visionary aims to achieve for youth services. And what we're waiting for, but hasn't come out yet, is grant opportunities for us to bid for in the development and implementation of what is the visionary national strategy. So we're still waiting for that, but we are positioning ourselves as a partnership in a good place so that when, I hope, not if, those opportunities become available, we can be very quick off the mark. but we are doing things within that strategy already, like one of the things that we've agreed and we're funding between the local authority from the local authority is the development of the qualified youth worker, which we've got an absence of across Herefordshire. So we're looking to have 2, maybe 3, but definitely 2 youth apprentices. And the vision of those workers is that they will be able to then work within Herefordshire to support the non-qualified youth worker sector in terms of skills, quality, those kind of things. So there's a whole range of things, as you say, it's coming in October that you'll see that we're looking to develop this year.
Thank you. I can see that Councillor Davis has got a question.
Yes, thank you. Well, observation and a question. I want to go back to Lindsay about the age range up to 5, preschool and attending school. What I've noticed in my area is that children have, because they're always playing on their machines, I'm finding that their comprehension, their language is just very, very poor. I was just wondering, when is slow learning and dyslexia picked up? Does that happen in preschool, or does it happen when they actually get to school? Because it's all very well talking about, when they become teenagers, but, let's find out something before they even get there. Thank you, Lindsay.
Thank you. I'm not a clinician, so I can't kind of honestly say when dyslexia is picked up, but I imagine that it's at the writing kind of phase. All I can say, though, is that with the universal portage worker, I would hope that some of those kinds of behaviours would be picked up. Certainly the health visiting checks at 2.5 and 3 will pick up speech and language issues specifically. And if there are any issues, then there is a kind of an automatic referral to speech and language therapists working in the community. So there's a new kind of offer that's been available for the last 6 to 8 months, I think now, from the Wye Valley Trust speech and language team. So that parents are given an opportunity when their children are at 2, 3, 4, to go and have some kind of an assessment and to get some support around speech and language. So the earlier that it's picked up, obviously, the better. I'm not entirely sure in terms of dyslexia itself, but any kind of issues, because communication issues are one of the very specific things that health visitors look at. So they look at physical development, cognitive development, social, behavioural kind of development, emotional and speech and language, communication issues. So those issues would be picked up very early, and certainly there is a direct link between health visiting and other therapies that are available. They would be referred straight away, and we also now have early years settings available to refer to the community speech and language sessions as well. So I would hope that children are being picked up now pretty early, and it will continue that they will be being picked up very early, so that they don't have to go on a waiting list for specialist therapeutic input.
Thank you. I'm not talking about this child, but I'm talking about a personal issue, if that's okay. That a child in the family wasn't forwarded to the right department until they were 7. They had to wait until they were 7 years of age. And one of the reasons how it was found out was because I asked about the blackboard in the school. Does your teacher write much on the blackboard? And she said, I can't see it. I'm sorry, but that's something very simple. And I know it's nothing to do with what we're talking about now. It's just an observation of what can happen, can go wrong.
Yeah, and I think that that's the whole point of, having the really good early help support, that hopefully issues like that can be avoided. Thank you. Does anybody have anything else that they want to ask about the report? No, I think, I mean, thank you so much, both Victoria and Lindsay, and you know, the whole team. I mean, what we found through doing the report was that the kind of breadth of support out there, early help support across Herefordshire was really outstanding, and the commitment from people towards improving outcomes for children and young people was really good. You know, we've felt that building on existing strengths, supporting the key partnerships, investing in sustainable community-based services, the Council and partners could continue progressing towards a child-friendly Herefordshire, which we've already started, and that this was a really good step in that direction, making sure that every child was safe and valued and healthy and able to reach their potential. So we really hope that the review highlights the outstanding work that's taking place, where it acknowledges the dedication of the people, communities and the different organisations that are making that possible, and that by recognising the achievements and sharing opportunities for improvement, we could support partners in building their successes and continuing to make a positive difference to those children and young people and their families. So within the Task and Finish report, there are 4 main recommendations which are highlighted there. One, obviously developing a long-term sustainability plan for family hubs, increasing access to safe, free and welcoming spaces for young people through the youth strategy, reviewing council support for the voluntary and community sector, which we will take to Scrutiny Management Board to ensure that the delivery of early help and the pressures faced by different organisations was well supported by the council, and sharing and embedding the good practice across services and partners, including relational practice, co-produced approaches, locality working and the community development model. So hopefully this is a report that can be shared with partners, that can be sort of put up as an example of the really good practice that is happening in Herefordshire. There were, within each category, there were sort of a smaller list of recommendations which we're going to use to help inform our sort of development of the work programme. But it would be really good to, as I said, bring this back earlier next year, just to see sort of where we're going with that. So everybody's on the committee's had a look at the report. Hopefully you're happy just to sign it off, and we can make sure that this report goes to the executive so that they can take on board the recommendations made in within that. And I've actually lost my script, so I'm a bit off-piste at the moment. Is everybody happy to vote on that report? Yep. Okay, we just take that as accepted on block. So thank you. That we may well have some recommendations that we would just quite like to discuss following the meeting today. But I think in terms of the information that you've brought to us, and it's been really valuable. I think the work is really exciting. I think it's hugely exciting for families and young people, children of Herefordshire. So, and you know, hopefully the launches that are coming up in August and September will go really well, and that schools feel well supported as they enter that new phase also. Great. You're welcome to stay if you'd like to stay. If you'd like to leave, please feel free to do that. As a committee, do we feel have we got recommendations that we would like to make with regard to these items? No, obviously we've got the recommendations from the report, and I know that Councillor Davis, you'd made a suggestion that do you want to take over, Daniel?
Yeah, of course. So obviously there are 4 recommendations coming from the Early Help Task and Finish Group report, and we'll send those on to the relevant officers for an update in due course on that. And we'll report that back to the committee when we hear back from them. With regards to the meeting itself, Councillor Davis made a suggestion that we acquire some of the data around the self-referral form to see so you could see the take-up rate of that compared to other means of referral. I've suggested that obviously from the Task and Finish Group report you generated a large number of suggestions or recommendations which I think it's been felt that they might serve as a basis on which to further scrutinise this in the new year as a progress update. I suggested in the side chat to Councillor Davis that perhaps we add that to that list of things that we use as lines of inquiry for that future meeting, and Councillor Davis indicated then that he was happy to do that. So I suggest at the moment that there are no recommendations from either of these items other than those in the Task and Finish report suggested to me.
Is everybody happy with that? Yeah.
Can
Tina?
I just clarify, because we were talking about two different items, and that recommendation about the data on the self-assessment is within the Families First.
Correct.
So the Families First item and an update on that and the implementation of that and where that's gone in January, February is what you're talking about. Not these recommendations from
no.
the early help task and finish group.
That's right. I think what the suggestion is that there wouldn't be a recommendation pertinent to the Families First item. That the suggestion that Councillor Davis made around
the data is included in as we update on the Families First programme, and you're going to put that in the programme in January or February.
Okay. Yeah. Okay.
Okay, thank you. And the recommendations from the Task and Finish report, which are in the report, there are 4 main recommendations. Those will be going to the executive. Okay, great.
Sorry, 3 of them are going to the executive, 1 of them will be going to SMB.
Sorry, thank you very much. 3 are going to the executive, 1 to SMB. Okay, so that just brings me now to the item on the work programme. So the work programme, we actually still need to do some more strategy work on that. So before we update that work programme, we'll have to have a work programming meeting, which we'll do over the summer. So that's been called, and we've got obviously we've got the youth strategy and youth services, etc. That update coming in October. So as the work programme stands at the moment, that is how it is, but we'll update it. So there'll be an updated version by October.
Correct.
Okay, thank you. So I think that actually just brings us to the end of the meeting with an early finish, which is great. The date of the next meeting is the 6th of October at 2 p.m. So thank you very much everybody for attending. Can I please ask that unless you've got any formal business, please exit the Plough Lane site. I'll formally close the meeting. Make sure you've got all your personal possessions. Can I make sure that the live recording has been stopped?